Hi, my name is Dr. Norvishie Arkutu, and I'm the lead clinician and CEO of Platinum Orthodontic and Dental Services. I am super excited to be interviewed by Just for Women Africa. So for me, picking dentistry was really about practicality. I fully admit to being royally confused, and whilst doing my A-levels in England, I applied for everything from biomedical sciences at Oxford University to English and drama at Leeds University. But in the end, I chose a career that would mean that wherever I ended up in the world, it would afford me a certain class as well as a certain income. Having lived in many countries along the way, this was really important to me. But the other thing about dentistry is that it's actually really sold as a women's career, because in theory, you can decide on your working hours and you can actually work for quite a long period of time into pregnancy. So harnessing both of those things, practicality for women, as well as looking at an international stage, it seemed to be a choice that would fit in with what I planned for my future. So for me, some of the challenges that I faced really were about naivety. However, I also am very aware that without that naivety, I would not have strove for so much. So the first real challenge was doing a purpose-built practice. So building from block to block, from plan stage to actually, execution. And that, for anybody who has built even a home in Africa, you know the challenges that brings. But once we started with operations, then the biggest challenge became about HR. And that's because dentistry is still in its infancy in Africa. That also means that there is great opportunity, but with opportunity also comes the hardships of the fact that there are not specifically trained personnel that are available and that you have a pool of to actually select from. So very quickly, I decided that part of this growth, and if growth was going to be something that we were going to aspire to, then we really needed to form a tribe, come up with like-minded individuals which would help to attain the vision, but which would also mean that they could then peel off and form their own tribe, thereby increasing the actual influence of what one is able to do, which I do think is pivotal in the health sector. So here at Platinum Dental, we really pride ourselves on being international. So every single thing that you would expect to be available in an international dental practice, wherever you were, are available at Platinum. So that extends from a main focus on prevention to having a lot of specialist services, from pediatrics, including nitrous oxide sedation. We also do implants. I am, of course, an orthodontist, and Invisalign is one of my strongholds. As a side, but also in terms of interest, I also do Botox and dermal fillers. So this is really a one-stop shop where you can get all of your dental needs met under one roof. Oh, wow. So I actually entered dental school in 1993, so that was 31 years ago. And during that course, the whole nature of dentistry has really transformed and changed. What I would say is the biggest change is actually communication. So there's a lot now that goes to communicating with clients and making them aware of what their options were. Especially in Africa, there's been a shift which has been gradual, but it's really taken hold from the doctor being seen as a godlike figure who imposes treatment on you to actually being part, so that there is a higher level of informed consent and that options are explained to clients. Even the choice of calling people clients rather than patients comes into this. But during that 30 years, the other thing that has really taken hold is technology, and technology in all the various sectors, from how you actually attain your patients, but even more, if we just look at the clinical aspects and focus on three things, there's been a real shift from conventional toothbrushes that are still used a lot, but now to a higher amount and percentage of people opting for electric toothbrushes. This makes such a world of difference in terms of oral health. So from going to that, we then have more technology-driven things, whereas now impressions that we used to take that people hated the slimy feel of have now been replaced with scanners, which allow you to actually video somebody's teeth in effect in a three-dimensional way and allow you to present this to the client. This makes such a big difference, because what's really interesting and exciting is that the client usually comes up with their own treatment plan and can tell you what is actually wrong. So this is bringing the client into the discussion and making them a center and focal point. And then the other difference for me as an orthodontist has been the huge shift from conventional braces, whether metal or ceramic, which were fixed, to what we now call clear aligners, which are almost invisible, and thereby expands the range of people who will opt to have their teeth and their bite straightened. So the really, really exciting things in terms of dentistry is that there is so much change, and the change is literally year on year. So we have definitely kept abreast, but what's exciting is what the future holds, and we will continue to make sure that we are at the cutting edge of dentistry internationally. I think that's a really great question. The biggest challenge at the moment, especially in Africa, is what I would term lack of regulation. And then the second biggest challenge is that fine line between what is clinical and what's cosmetic. So when you put those two challenges into a melting pot, you can end up with deregulation and people doing anything that they want to do. Now, we need to be careful about this, because aesthetic and cosmetic is a strength. However, there is also a line at where you are now not adhering to clinical competence, where you are now not adhering to what's in the patient's best interest in terms of dental health, but striving for what the patient wants in terms of aesthetics. When you have that coupled with deregulation, it means that we now have people who will watch things on YouTube, have no formal medical or dental training, and then perform dentistry on unsuspecting individuals. So moving forward, I think that those are the real areas that may be a threat. We need to really look at regulation, and then us as a profession also need to be very, very clear about the fact that at all times we are dentists first, and we should be safeguarding the patient's dental health as our focus and as our priority. The use of AI in dentistry is huge, and it really, really starts with client acquisition. So how do you even engage the client in order to get them into the building? And that's where the AI actually starts, from using prompts such as ChatGPT to help with marketing strategies to make sure that you are targeting the right patient group. But once we are within the surgery, the AI in dentistry is just mind-blowing. So I think that a lot of us can remember when dentists and all medics used to hold up x-rays to actually subjectively interpret those. Now, x-rays have almost all moved digitally, and with the digital interface, an AI can now interpret the x-ray for you objectively, but then overlay the patient's preferences, so that rather than having a stark contrast of this needs to be treated, this doesn't need to be treated, it will put nuances on that. Is this patient's diet so acidic that not treating this now is going to lead to further problems? So even in our diagnostics now, AI plays such a huge role. In terms of our communication with patients and clients, that's then on a totally and utterly different level. So I'll try and explain this using a scanner. So a scanner literally allows a 3D interpretation of what's going on in the client's mouth. So if we look at this scanner here, the patient can definitely see that their bottom teeth are becoming extremely crowded, and that this is something that will not only affect how they bite and chew, but also the aesthetics, which has such a marked influence on confidence. But one of the things which we can also do is to look at the function of what's going on. So with this, we can actually do a typographical map to look at where patients may be biting too much and where they may be grinding and clenching. And once we have this sort of software, then it's only a throwaway in terms of the AI being able to simulate what things should actually look like. So we're now going to look at this patient before having their teeth aligned to after having their teeth aligned. And again, once we actually do this, what we can see here is that the patient can see at first hand what the actual improvement is going to be. So we've gone from having a very, very crowded bottom jaw on this side of your screen to the client having their teeth nicely aligned on this side of the screen. So what happens with these aids is that the patient, again, is able to take part in the decision-making process. And this can generate everything from how long treatment is going to be. One of the amazing things about harnessing AI is how quickly things can be done. So with the use of AI, for example, although I'm based in Accra, Ghana, I can access any laboratory in the world to actually make a prosthesis for my clients. And then the client does not also need to be in Accra, Ghana to have a lot of the treatment carried out. We can monitor patients virtually, and the whole AI thing allows for a more wholesome experience. So from the client's point of view, we find that we are able to diagnose significantly more effectively, and that the other areas of providing care is extremely narrowed, so that things are able to be done significantly quicker and at a much higher precision than without AI. So the fact that AI is learning all the time also means that as we look into the future, things are only going to get better, both for the clinician and for the client. Clients are usually wowed by the use of AI. because for us, the integral part is using AI to enhance the client's experience and to enhance the client's decision making. So a lot of the time when we are presenting things to our clients, they don't necessarily sit back and think that, oh, this is AI which is actually doing this. But they are extremely appreciative of the time spent and the fact that we all know that an image says 1,000 words. So the imaging is really, really important. In AI in healthcare, we do need to always be cautious about confidentiality. So one of the things that we are very, very aware of is how we store the actual data and how we protect the patient's confidentiality in all that we do. But overall, AI is a game changer. And what we find is that the clients love it and love all the benefits that come with it. So I think that AI replacing dentists, etc., has a bit of a way to go. But in terms of replacing certain functions, definitely. So it wasn't even 5 years ago that I spent so much of my time taking impressions myself. But now, with the fact that we are using scanners, it doesn't have to be me, the clinician, who's doing the scanning. So what we definitely know is that AI is making things extremely more efficient, but with that efficiency means that there has to be a drive for retraining and changing the actual skills of those who are involved in dentistry. So if we even look at braces and how teeth are moved, we have gone from seeing our clients once every 4 to 6 weeks to being quite happy using AI to see our clients once every 10 to 12 weeks. So you can imagine that with that, our capacity to treat more patients obviously grows. So AI is definitely an amazing assertive tool, but us as clinicians and humans have to always interpret what AI is doing and then look at how we change our skills and our training to always be harnessing AI, but keeping our actual workforce intact. So the last 10 years have been really, really exciting. And first of all, there's been the change from having to think as a clinician to a business person. But if there were 4 things that I would highlight, then the first thing that I would highlight would have to be ethics. I think that ethics should really be the bedrock, and that continuing to adhere to your ethics over and over again does pay off in the long term. The second thing that I would say is what I call the human factor. Whether we like it or not, growth is dependent on people. And so your ability to grow a team and keep that team with you, with all the HR parts that goes with that, I think it's really, really important for business. The third thing I would say is about consistency. So consistency matters. You can't be amazing one day and then totally and utterly rubbish the next day. There has to be this consistency and this relentless pursuit of excellence. Are we doing it to the best of our ability day in, day out? And then the fourth thing which I would highlight is your ability to be flexible, to change, and to keep abreast of the changing environment as well as changing developments. So I would always say that having mentors is really, really key, and that for anybody in business in Africa, you almost need 2 sets of mentors. You need the mentors that are grounded with you in your locality, and then you need the mentors that are in the West, that are maybe a few steps ahead of you, so that you can literally forecast and experience what there is out there and what may be coming to you. So I think that those 4 things for any business become really, really critical and are fundamental to growth and success. So I think that for us at Platinum, if we look at the next 5 to 10 years, then we are on a growth agenda. And that growth agenda is going to be fueled by technology and AI. So what I foresee is greater efficiency. I also foresee that, especially in Africa, we are still extremely youthful. So I foresee that whereas currently there are only a certain sector of people who are participating in the dental world, that sector is going to significantly increase. Also, in terms of our locality, AI and technology is making dental education highly available. So now you can literally sit and get all of the knowledge that you need at home rather than having to foot the expense of going out. So I think that there's going to be this burgeoning of increased amount of patients, increased efficiency and care, increased technology and know-how, but the center of all of this is the client. So whilst we go on this AI agenda and growth, the really, really important thing is to keep focus on the fact that the client is what's pivotal. And as you employ AI, you need to perhaps even do more in terms of patient contact and making sure that you are engaging the right way with your clients. So for the next 5 to 10 years, it's exciting. It's looking at growth, it's looking at efficiency, and it's also looking at development. So we really could not end this without giving some dental tips. So my number one dental tip for Africans and for Africa is to remember to brush twice a day. We are all really good brushing in the morning because of how our social structure is. But the one thing that we find is that less than 15% of people are doing the nighttime brush. So please remember the idiom that you are meant to brush twice a day for 2 minutes. So the 2 minutes is also really, really important. The second dental tip is just be conscious of how frequently you are ingesting sugar. So try not to worry so much about the quantity of sugar, but start thinking about the frequency at which you're introducing sugar into your mouth. And then the third thing is that it is really important to visit the dentist twice a year. Remember that the visit is not only about decay and pain, but we are wearing our mouth cancer ribbons at the moment. Your dentist is checking for other things that you may not be aware of, and we are able to detect a lot of systemic diseases during your checkup. So please do remember to be visiting your dentist twice a year. So if you do need some further information or need to come and see us, then all our information is available on our website, www.platinum-dental.com. Alternatively, you could just give us a call on +233 302 998 750 or +233 508 923 041. You could also look us up on our social media handles, Platinum Dental Services.